I'm Hamish Rutherford from NZME. We're here for HealthCentral ChalkTalks, the future of New Zealand's healthcare. How do we achieve a more productive, sustainable and equitable healthcare system? I'm joined by Dr Janice Wilson, Chief Executive of the Health, Quality and Safety Commission. Janice, how variable are the outcomes for people with health challenges in New Zealand?
Well, the first thing to say is that the vast majority of people really get good health outcomes for their health challenges or their illnesses. But we do see that there's geographic variance. We do a thing called an atlas of healthcare variation, and we see that sometimes there's geographic variation. There's often variation around ethnicity, so there's particular poorer outcomes for Māori and often for lower socioeconomic people. And people talk about a kind of postcode lottery, so sometimes it does depend on where you live as to how easy the access is to healthcare services. As you can imagine, you know, in some rural areas it's harder to access. But also we find that people's journey through the system, sometimes there is variation in how people are treated depending on where they live, or often their ethnicity, or sometimes their age or gender, and therefore you get a variation in outcome. And the most striking thing that we find is that Māori in particular have much, much poorer health outcomes than the rest of us.
What can we do to improve that?
Right, well there's probably a number of things that we can do. First is, you know, letting people know that, so that practitioners and health boards can start to look at their population. Young people quite often don't go to primary care because they can't afford it. So there needs to be some thinking, I suppose, nationally about how that issue is addressed, the financial barrier. But there are issues too about biases that practitioners have that are implicit and perhaps not recognised, and people tend to be treated differently. We know that Māori and some other groups perhaps get less medication than if you are non-Māori. Maybe you don't get seen quite so soon or quite so smoothly through the system. And so that there is that implicit bias or institutional racism, I think what people are talking about now, needs to be addressed. And the Medical Council are putting out some new guidelines soon to help medical practitioners think about their impact and their culture and how to address those kind of issues.
Dr Janice Wilson, thank you very much for joining us.